Right now, hold your hand up in front of you. Look at your nails. Not the polish, not the length, not whether you need a manicure. Look at the actual nail plate, the color beneath the surface, the shape of the nail as it grows out from the finger, the texture, whether the surface is smooth or ridged, whether the nail curves downward at the tip or upward at the sides, whether the skin beneath the nail is pink or pale or bluish, whether the white crescent at the base, the lunula, is visible on all fingers or only some. What you are looking at is not cosmetic. According to research published across cardiology, hepatology, pulmonology, and dermatology, your nails are one of the most information-dense visible structures on your body. The nail unit, the plate, the bed, the matrix, the surrounding skin receives blood supply from a dedicated vascular network that reflects the circulatory and metabolic state of the entire body. Changes in oxygen delivery, liver function, kidney function, nutritional status, thyroid activity, and cardiac output all produce visible, documented, reproducible changes in nail appearance. Dermatologists call this nail semiology, the systematic reading of nail signs as clinical indicators of systemic disease. It is taught in medical schools. It is documented in thousands of peer-reviewed papers. And most people walk around every day with their nails telling a story that nobody has taught them to read. Today we are going through the signs, shape by shape, color by color, because some of what you are about to see on your own hand has been there for months or years, and it has been trying to get your attention the entire time. Before we get into specific signs, you need to understand why the nail reflects internal health at all. Because the mechanism is what makes the diagnosis credible rather than speculative. Your nails grow from the nail matrix, specialized tissue at the base of the nail beneath the skin. Matrix cells divide continuously, pushing the nail plate forward at approximately 3 millimeters per month for fingernails. The nail plate visible on your finger today represents roughly 3 to 6 months of nail matrix activity. The nail matrix is exquisitely sensitive to systemic conditions because it is one of the most metabolically active tissues in the body. Any disruption to its blood supply, oxygen delivery, nutritional substrate, or hormonal signaling produces visible changes in the nail plate being formed at that moment. Some changes appear immediately as lines or color shifts. Others accumulate gradually over months. Because each millimeter of nail represents approximately 10 days of matrix activity, examining the nail is reading a timeline of your internal health across the past several months. This is why physicians examine nails, not as a cursory ritual, but as a structured clinical assessment with documented diagnostic value. Clubbing is the nail sign with the longest documented history and one of the strongest associations with serious internal disease. And it is the sign most people have never been taught to recognize in themselves. Normal nails emerge from the finger at an angle of approximately 160 degrees. There is a slight depression, a visible gap, between the base of the nail and the skin above it. In clubbing, this angle increases to 180 degrees or beyond. The nail bed becomes spongy when pressed. The fingertip itself enlarges, becoming bulbous and rounded like the head of a drumstick. The nail curves downward over the tip of the finger. The mechanism behind clubbing involves platelet-derived growth factor and vascular endothelial growth factor, compounds released by platelet aggregates that form in conditions of chronic hypoxia or chronic inflammation. These growth factors stimulate abnormal vascular proliferation in the fingertip tissue, causing the characteristic soft tissue enlargement. A 2012 review in the American Journal of Medicine confirmed that clubbing is present in approximately 35% of patients with lung cancer at diagnosis, making it one of the most visible early paraneoplastic signs in thoracic oncology. It is also found that approximately 38% of patients with cyanotic congenital heart disease, in chronic suppurative lung diseases including bronchiectasis and empyema, in inflammatory bowel disease, and in liver cirrhosis. The Shamroth window test is the simplest self-assessment. Place the same finger of both hands back to back at the nail. In normal nails, a small diamond-shaped window of light is visible between the nail bases. In clubbed nails, this window is absent. The thickened nail beds eliminate the gap. If you press your fingernails together right now and cannot see any light through the junction of the two nail bases, that finding warrants discussion with a physician. Not tomorrow, this week. Koilonychia, spoon nails, is the sign pointing most directly at iron metabolism. In koilonychia, the normal convex curve of the nail reverses. The nail flattens and scoops inward, creating a concave shape that can hold a drop of water placed on its surface. If your nails are spoon-shaped, you will see it immediately. The mechanism is specific. Iron is required for synthesizing the cytoskeletal proteins that maintain the nail plate's structural rigidity and normal convex curve. When iron stores are depleted, The plate deforms inward under the mechanical forces of the surrounding tissue. A 2016 review in the Indian Journal of Dermatology confirmed koilonychia in 30 to 50% of patients with iron deficiency anemia severe enough to produce systemic symptoms. If your nails are flat or concave, you are looking at an iron metabolism signal. A serum ferritin level and complete blood count are the first investigations the nail sign points toward. Iron deficiency affects over 2 billion people by WHO estimates, and koilonychia is one of its most visible and most overlooked physical signs. Terry's nails are one of the most diagnostically specific nail signs in internal medicine, and they are named after Richard Terry, the physician who first described them in 1954 in a cohort of patients with liver cirrhosis. In Terry's nails, the nail plate appears predominantly white, not from the tip, but from the base. The white coloration occupies 80% or more of the nail length, with only a narrow band of normal pink coloration remaining at the distal tip, typically 1 to 2 millimeters wide. The lunula, the white crescent at the base that is normally visible, disappears into the general white background. The mechanism involves reduced vascularity in the nail bed, fewer and smaller capillaries beneath the nail plate, reducing the blood volume that normally gives the nail bed its pink color, combined with increased connective tissue. This reduced vascular density is a response to the same hepatic and circulatory dysfunction that characterizes several serious systemic conditions. A landmark 1984 study by Bean in the Archives of Internal Medicine found Terry's nails in 80% of patients with liver cirrhosis, 25% of patients with congestive heart failure, and 15% of patients with adult-onset diabetes. A 2011 update in the Journal of the European Academy of Dermatology confirmed these associations and added chronic kidney disease to the list. Terry's nails are not a sign of a single condition. They are a sign of serious systemic disease affecting the liver, heart, or kidneys, a finding that, in a patient without a known diagnosis, warrants comprehensive investigation, including liver function tests, cardiac assessment, and renal panels. Look at your nails right now. Is the nail bed predominantly white, with only a thin strip of pink at the very tip? If yes, and if you do not have a known diagnosis of liver, cardiac, or renal disease, that finding deserves medical attention. Lindsay's nails, also called half-and-half nails, point more specifically at the kidney. The proximal half of the nail appears white or pale, and the distal half appears pink, red, or brown, sharply demarcated. The mechanism involves reduced vascularity in the proximal nail bed, producing whiteness, and elevated beta-MSH, a melanin-stimulating hormone that accumulates in chronic kidney disease, producing the darker distal zone. A 2009 study in the Indian Journal of Nephrology found Lindsay's nails in 21% of patients with chronic kidney disease, with prevalence increasing as kidney function declined. Its presence without a known renal diagnosis should prompt a basic metabolic panel, including creatinine and estimated glomerular filtration rate. Yellow nail syndrome is a rare but diagnostically striking condition in which all nails become thickened, excessively curved, and uniformly yellow to yellow-green, with absent or greatly reduced growth rate and loss of the cuticle. The syndrome is associated with lymphatic dysfunction, impaired lymphatic drainage causing fluid accumulation in tissues. It appears in association with lymphedema, pleural effusion, and chronic respiratory conditions. A 2014 review in the Journal of the American Academy of Dermatology found approximately 40% of yellow nail syndrome cases are associated with a respiratory condition, and approximately 10% with internal malignancy. Importantly, yellow nail discoloration from fungal infection, onychomycosis, is far more common and produces a similar appearance. The distinguishing features of yellow nail syndrome are the extreme slowness of growth, absent cuticle, transverse overcurvature, and bilateral symmetry. A dermatologist can distinguish these clinically and, when uncertain, with a nail clipping for fungal culture. Bose lines are transverse grooves, horizontal indentations running across the nail plate that appear when nail matrix activity is temporarily interrupted by a severe systemic insult. The nail matrix pauses during the insult and resumes when the body recovers, leaving a groove that functions as a timestamp encoded in the nail plate. The distance of the Bose line from the cuticle tells you approximately when the insult occurred. Each millimeter from the cuticle represents approximately 10 days. Bose lines appear after severe febrile illness, major surgery, chemotherapy, myocardial infarction, and severe nutritional deficiency. A 2020 case series in the British Journal of Dermatology documented Bose lines in patients recovering from severe COVID-19, appearing 2 to 3 months after the acute illness, consistent with the nail growth timeline. If you have a horizontal groove across your nails right now, calculate backward from its position. That calculation will point you to a period of significant physiological stress your nail matrix recorded at the time. Blue or cyanotic nail beds, where the skin beneath the nail plate appears blue or purple rather than normal pink, most directly reflects cardiovascular and respiratory status. The blue color is produced by deoxygenated hemoglobin in the nail bed capillaries. In a healthy person, circulating hemoglobin is predominantly oxygenated and appears red, giving the nail bed its pink color. When oxygen saturation drops due to heart failure, chronic obstructive pulmonary disease, pulmonary embolism, or severe anemia, deoxygenated hemoglobin accumulates and the nail bed turns blue. A 2018 study in Chest found that peripheral cyanosis detectable in nail beds corresponded to oxygen saturations below 85% in the majority of cases. If your nail beds appear blue or purple right now, not from cold exposure, which produces transient cyanosis reversing with warmth, that is a cardiovascular and respiratory signal requiring immediate evaluation. Here's what I want you to carry out of this video. Your nails are growing right now, millimeter by millimeter, recording the state of your internal health in a format that is visible, free, and available on your own hand at any moment. Clubbing, no diamond window between your nail bases, cardiac, pulmonary, or hepatic disease. Koilonychia, concave, spoon-shaped nails, iron metabolism dysfunction. Terry's nails, predominantly white nail bed with thin pink tip, liver, heart, or kidney disease. Lindsay's nails, sharp white proximal and pink or brown distal zones, chronic kidney disease. Yellow nails, lymphatic dysfunction or malignancy. Bowes lines, time-stamping a past systemic insult. Blue nail beds, oxygen saturation below safe levels, cardiovascular and respiratory emergency. Look at your nails right now, all 10 of them. Check the shape, the color of the bed, the surface texture, the presence of lines, the angle at which they emerge from the finger. Give them 2 minutes of attention they have probably never received. What do you see? Drop it in the comments. Tell me one thing you noticed on your own nails today that you had never paid attention to before. I read every single one. Subscribe to the channel because next week we are going into another part of your body that has been leaving clinical signals in plain sight for years. The signs are there. Now you know how to read them, and I will see you in the next video.